Hi, welcome to this week's Nurse Coach Duo. This week, we're interviewing Dr. Alaina Johnson. She's a psychotherapist that specializes in women's emotional health across the lifespan. We get into relationships, both romantic and friendships, and how they can change in midlife, about building new relationships and repairing old. You are not going to want to miss this. This is a fantastic conversation. Before we dive in, just a quick reminder. This episode is for educational purposes only and isn't medical advice. If you're dealing with a health issue, please check in with your healthcare provider. Hi, welcome to this week's episode of the Nurse Coach Duo. I'm Jen Schroer. I'm the owner of Clarity Health and Wellness Coaching.
And I am Angie Maguire. I am the owner of Coach Angie. And we are so excited to have Dr. Alaina Johnson on with us today. Welcome, Alaina. Yes, Dr. Alaina Johnson, so excited, is a licensed psychologist specializing in women's emotional health across the lifespan. With over 2 decades of clinical experience, she supports women navigating the complex transitions, including pregnancy, postpartum, motherhood, midlife, and menopause. Dr. Alaina provides compassionate care to help women manage anxiety, heal from trauma, and manage life transitions. As a mom of 3 who are all engaged in the performing arts, she wrote the book Parenting Talent, The Grown-Up's Guide to Understanding and Supporting Creatively Driven Teens and Tweens. She resides outside of Chicago with her husbands and sons. So
Nice.
welcome.
Hey,
Oh,
welcome.
thank you so much for having me.
Yeah, very exciting. So I know in your bio it talks about your other niche, but your other passion is and where we've connected is your work with women in midlife and women across the lifespan. And I think the first time I met Alaina, she was saying you've grown up with your patients, if you will, right? So
Absolutely.
and so you really feel like you specialize in supporting women through major life transitions. And of course, we know midlife and menopause is one of those life
Yes.
transitions. It's a little bit about how it feels to kind of grow up with your clients or your patients, and all of a sudden find yourself and your patients in midlife.
It's actually been incredibly fun, to be honest. If you had asked me when I was first deciding I wanted to be a psychologist, where I thought this would lead me, this is not at all where I thought it would lead me. I actually originally specialized in pediatrics, and that's what I thought was going to be my primary focus. But in that process and having worked with kids with some developmental disabilities and things, I was watching what was happening to the parents and
Mm.
specifically the moms. And when I was watching that, I had a great interest in kind of how does all these different things impact your identity as a mother. So that became my dissertation. And that kind of led me into this whole world of working with women who are dealing with pregnancy and postpartum and pregnancy loss and infertility. So that's kind of where my niche started. And from there, it grew to dealing with a lot of women who have all the things that kind of can come with some of those experiences, including anxiety and depression. And so, what has happened over the course of my career is that, of course, several clients kind of stick with me. They decided
Mhm.
to, we call it, tune-ups. So they might do that initial year or two of therapy and they're getting a good place and they're stabilized. And then, 2 or 3 years later, can I see you again? Something else has come up. And yes, of course, wonderful. It's great. And what that has led to was that then, of course, we were kind of going through parenthood together and what that's really like. And as your children start school and some of the challenges that come there. And over time, like all of us, I hit that place in life where I was going through perimenopause. And I recognized some of it in hindsight that a lot of the things that I was dealing with in perimenopause hadn't been really addressed. I really feel like it's only been over the past 5 years that we're really seeing a
Mhm.
lot of those things. And I was always a therapist when a client would come in and they would say, I can't sleep and I think I'm having anxiety because I can't sleep. And like I'm breaking out into these sweats, and they'd give me all these symptoms. And I'd say, okay, absolutely, could be anxiety. Can you do me a favor? Can you go into your doctor and get your thyroid checked first? Happy to work with you, but can we make sure that we're not, fighting upstream because there's an underlying medical issue going on here? And so it was the same thing I was seeing when we were dealing with perimenopause, that sometimes that was either exacerbating the problems or was the source of the problems. It wasn't actually just an emotional issue going on. So that kind of helped me continue down that path of, as I'm learning things, that I start bringing these up with my clients and that we started working on them. So it's been an incredible adventure to kind of have my clients follow some of the developmental things that I myself have gone through, and I really enjoy it.
Yeah. I find so many of the women who work with women in midlife are have a very similar story to what you're saying, where we started going through it and we recognized it, or we recognized it in other people, and we're like, why is this trend happening? Right? Like, what am I seeing? And thankfully, we have enough people that are noticing that and trying to work with it instead of just, oh, yo, you're depressed, or oh, it's the stress of childhood, it's the stress of sick parents, all of these types of things. Because when we just throw that away and not consider that it could be something else, and thyroid is a perfect example. I mean, like, that would be detrimental to the patient if you didn't figure that out, right? So I love that
Absolutely.
that you were willing to look outside the box and dig in, not just go, this is what I learned at school. This is what I know what to do. You know what I mean? And just
Right.
track on that way, because not everybody's willing to do that.
And
Yeah.
why aren't they responding to treatment? I don't understand.
Right.
Oh, there's a medical issue
Exactly.
underlying all of this. So
Exactly. So can you tell us, just through your experience of working with these women, especially through all the transitions, what kind of themes or patterns that you're seeing, whether it's in perimenopause, menopause, or even just across the gamut, if you're seeing any type of patterns there?
definitely in midlife, what I've really noticed over the past few years is that two big themes seem to be kind of emerging over and over again for a lot of my clients. The first is this sense of emotional disorientation. They're going, I don't know what's going on. I'm not sure who I am. I'm not
Mm.
sure what I want anymore. I'm not sure what my life is going to look like. I'm not sure. Help. I just don't even know what I want. And I thought that I was supposed to be at that stage of life now where I had it all figured out. And no, like I feel like I'm back at 20 and going, what am I supposed to do here? So that's one of the first big things I see. It's just kind of this, it feels like they're in the upside down all of a sudden. Everything they thought they knew to be true, everything they had held on to, everything they said, I got this, I figured out my identity, doesn't feel the same anymore. And so it will come out through things like, I've worked so hard for this career. I have climbed that mountain. I'm finally at the top of the mountain. I hate it here. What am I supposed to do? This is not what I wanted. This is not what I was thinking about. Or I decided to set my career aside because I really wanted to 100% focus on being a mom. And so I did some other things, but I didn't really focus on it. And all of a sudden I'm looking up and my youngest is a junior in high school. And we are talking about college, and what am I supposed to do when they're gone all the time? I don't know what that means. Or I have women who, there's like, okay, I think I actually am in a really good place, except for I just got a phone call and my mother fell and she broke her hip, and I live far away, and now my life has been hijacked because I'm only child, and my life has been hijacked trying to figure it out. So that's one of the first big themes that I see, is just kind of this emotional disorientation around, I thought I had it figured out, and I really now am not sure that I so much do. And I don't know how to kind of get back into any kind of direction that makes sense for myself. And the other big one that I'm seeing is almost a surprise at how much relationships change during midlife. And relationships that they thought were going to be rock solid forever are suddenly very different. So there's the relationship changes we expect. We know, we may not be ready for it, but we know, if you're a mom, you know that your children are eventually going to launch, and that your relationship with them is going to change from being kind of the major guiding force to somebody who's more sitting back as more of a trusted advisor. But there's other relationships that people are saying, like, I didn't expect this, especially friendships. I hear a lot of women going, there were friendships I thought would be there forever. And the minute we didn't have our kids in the same activities, doing the same things, or we weren't hanging out for 4 or 5 hours on the baseball field every Saturday, they're not there anymore. And these relationships I thought would be there forever, or I didn't realize how much my relationships were based on proximity. I'm really good friends with my neighbors, but as my primary neighbors that I was closest to move away, suddenly it's summer weekend and I'm going, oh, we don't have anything to do. So that's another thing I see is just kind of this, either loss of friendship or shifting friendships, shifting marital shifts for sure. Sometimes it's the kids are gone and I'm realizing my partner and I are strangers. And in kind of like their friendships with other people, what they had in common was we did our social things around the kids. And
Mhm.
now that they're not here, what does this look like? And does this make sense? So those are the two biggest themes I feel like are very consistent when I start kind of digging into the, I always ask people when they come into therapy, why now?
Great
Oh, what
question.
a great question. Yeah. Because man, it's different all the time, right? Especially
Yeah.
with your tune-ups. I love that you have tune-ups. I think that, says a lot about
Yes.
your practice and who you are as a psychologist. So well, those themes, both of those themes that you've talked about resonate with me and myself, and also, hear from my clients and friends. And so I really appreciate you bringing those two things up. And, wanted to ask you about, I guess more on my mind, but right now is just like when friendships are changing, right? How do you, when you talk to your clients and someone comes in and talks about a friend maybe they thought they were going to have for life that you mentioned when you were just talking, how do you start the process of how do you advise someone to start the process of letting go, especially if maybe it wasn't your idea in the first place? You weren't expecting to
Right.
let it go. So
Right.
and it's maybe it's run its course, whatever it is, but how do you start the process of letting go?
Well, one of the things I will talk to them about is first we talk about the idea of developmental stages. And I have to remind women that this is another developmental stage. We're very focused on developmental stages being something that happens younger in life, and we're aware of that, and that these transitions are going to come up as things change. So we might sit down with our middle schooler and say, hey, you're going to high school next year. And I just want you to be prepared. Sometimes friendships change. There's going to be a lot going on. People are going to have a lot of different interests. So just kind of be prepared and don't take it personally if your core group changes. That's a normal thing to happen. We
Mm-hmm.
expect the same change to happen going to college, and we talk about it, and we are just mentally in a space that we're prepared for it to happen. So I like to remind women, motherhood, another transition. So this is just another developmental stage. And with that, who we connect with, why we connect with may shift, and that is okay. It is okay to have a reason and a season. That doesn't mean that wasn't valuable. And it doesn't mean that if for somebody else's reason a season has changed and you're the one that they're moving away from, that you've done anything wrong, that you are somehow inadequate. This is a normal developmental process that we go through. So the first thing I like to do is just normalize that this
Mm-hmm.
happens. And there's no judgment that needs to be had around that. And that if you are not the one who is initiating the change in the relationship status, it's okay to grieve it. It's even okay to say, "Hey, I miss you. I get that, we're kind of in different places right now and it might be hard for us to connect, but I just want to let you know I've just appreciated, all the things that we shared during this other phase of life." Or if there can't be a conversation, still making peace with it for yourself of I need to let that go. It's okay to say goodbye and recognizing that with a loss, now you have an emptiness. And so maybe it's time to look around and say, how do I fill this with something else? It can be other friendships, it can be other activities, but I'll say, talk to me about what purpose that relationship served. What did you get out of that? Relationships are they're going to go back and forth. You're going to share things, but what was it about this person? Why are you feeling the loss of this person so specifically? And when I make people dig, sometimes they find out, they go, it was, she's kind of right. We don't have that much in common anymore, but it was just a habit. I
Mm-hmm.
I had that person that we went for a walk every morning. And I knew that was part of my routine. But oh, if I think about it, our conversations have like really gotten to a point where we're kind of talking about the same thing over and over again because or we disagree on things in a way that we didn't used to because we've had different life experiences now. So we don't have that
Mhm.
commonality. So when I can get people to take that step back and really look at what is missing, then I say, okay, now we know what it is as the next thing to do to go out and look for to fill some of those needs for yourself emotionally.
So, first of all, I love the fact that you bring up that you can grieve over that, right? I think that's so super
Mhm.
important for people to understand that it's okay to be upset. It's okay, and there might be a process that you need to go through to get past that. I think that's super important, especially and even like kids who go away to college or don't come home after college and those kind of things. Same thing, right? Those are all transitions that, like you say, you can those at least you expect. Losing your friends you didn't
Mm-hmm.
expect, but like all of them are grieving. And
No.
so how do you guide the women or men? I mean, because definitely men are going through this as well, but I think it really affects women, especially in this life stage, because like you said, you thought you had it figured out, and now you're like, wait, maybe I don't. What are your recommendations on how to go find that replacement, whether it's in friendship or if it's in a habit or whatever it is? How do you guide people through that?
Part of it is exactly what I said. It's first you got to figure out what's missing. So what
Mhm.
is it? What resonated about this? Why are you feeling such a deep loss? Because what I can usually point out to women, I go, okay, be honest. Now that baseball's over, do you really miss all the moms? Even though you guys did stuff every weekend, and I'll usually get a little chuckle like more than others, to be honest. I'm like, okay, so some filled some other need for you,
Sure.
and some it's kind of like, okay, I don't have to make polite talk or laugh at the same joke this person tells all the time that I never find to be funny. So that's the first thing is figuring out what it is. Is it that you have a routine and an activity? Is it that, oh, this was my only friend I could talk about this one particular thing? It's the only person I have this thing in common with. And so it was nice to have that there. Is it, we both have kids who struggle with the same things. And I miss having that sounding board that
Mhm.
understands who I am. So I want them to go through that process first, because if you can identify that, then you can then say, well, how do I fill this? It's interesting because one of the big things women don't necessarily recognize is that unlike those other developmental changes in friendships I mentioned, what's uniquely different in midlife is you don't have a built-in population ready to go explore and try to find new relationships in. It's very different. So when you start high school, you're sitting with all these people who are the same age. They're going
Mhm.
to be they're from the same area. They probably are coming from families that are roughly the same SES as yours. So you have kind of a lot of things have been eliminated in terms of making it complicated. You've got a lot of candidates that are probably a decent match to start working from. And same thing for college. And so the first thing I say is you're going to have to put yourself out there and you're going to have to try. And you're going to have to think of it this way. If you're going into high school, let's say you have four classes with 25 students in them. So that's approximately 100 potential friendships. We would think nothing of it if you only came out of it with one really close friend. Literally wouldn't think anything of it. Like we'd be like celebrating with our kid, like, yeah, that's great. I'm so glad you found that person you connect with. But when women put themselves out there and they're like, okay, you said I have to try to start connecting with more people. So I tried 10 times and nothing happened. None of them stuck. I'm going, okay, no, it's going to take a little bit more than that. And it's a lot more work because you don't have this automatic pool of people who are roughly matched to possibly your same interests, the same way you look at things. You're not in college where, okay, the pool got bigger and a little bit more diverse, but still, you have all these opportunities for interactions that are built into your life. Motherhood, same thing. Whether it's that you join a group or that your kids you're sitting in the pediatrician's office. There's all these places that happens. So one of the first things I say is you got to put yourself in places that you're more likely to kind of narrow down the pool a little bit into what are
Mhm.
your interests. So what are the things that maybe you haven't pursued before? What are the things you actually are pursuing, but you've gotten very stagnant and it's only your group? It can be as simple as saying, okay, yeah, I have my same book club and, I kind of fell into it and I like them, but, I hear my friends and some of their book clubs and they seem like they're all really tight and they have these deeper relationships. I just don't have that. And I say, so join another book club. well, I've looked around, I can't find one. I was like, have you looked around outside of your immediate town? Or have you considered driving 15 minutes? So they kind of go, oh, because we tend to get locked into our own little bubble without thinking. So that's one of the big things too, is I say, you got it. You're going to have to step a little bit outside your bubble. You got to identify what is the need that you need met. Is it having something scheduled? Is it some kind of friendship? Then you need to say, well, where can I find people who are more likely to have this? And then the third being, and am I giving it enough time, energy, and effort? It's not going to take maybe 10 interactions. Maybe you look out and you'll meet somebody after 10, but it actually usually takes a lot more than that to kind of work your way through and meet. And it's okay if every connection doesn't lead to a friendship. It may be that initially it seems like it's a good match and yeah, let's actually meet for dinner. And you meet that person for dinner and you realize they're nice, but I don't know. It's just like dating. I don't know if this is a second date kind of situation. You have to kind of go through that process and be able to get in your head and realize, is this the right person to move on and have that deeper connection with?
That's literally what I was thinking too. It's just like dating. Maybe we need a menopause friendship app. Swipe left.
Yeah.
Well, and just like dating, I always say when people are like, I can't meet the right guy, I'm like, then you got to change where you're trying to meet guys. So you got to start thinking outside the box. So like when somebody say, well, okay, I'll volunteer. I'm like, okay, but if you're going to volunteer someplace where they're just going to assign you something, you're going to be your own little corner and that's all you're going to do, you're not going to meet people. Think outside the box. Is your friend hosting an event? Ask your friend, do you need any help with that event? Because if you know that event may have a lot of women your same age with maybe somewhat similar interests, that's a good place. And if you're shy, which is a whole different thing, that is another layer on this, trying to go out there and meet friendships. If you're shy or an introvert, that can help you break that ice. It can help you kind of go in and say, oh, I have a reason to talk to this person. Do you need help finding where you're going? What did you think of the last session? Whatever it is, but it gives you something to kind of work with if you're somebody who's because that's what I will hear a lot of too. Is like, okay, but I'm an introvert. And I'm introverted. So I'm like, I get that. I'm a social introvert, so I'm okay with the social stuff, but I am an introvert. So I understand that. I give this example to them when they're asking. I said, I have a friend that I can say is very extroverted. I said, if we were both stuck on the expressway, there was an accident, we know it's going to take us 3 hours to get home, and we're both like, forget it. This is not worth it. We're just going to pull off and find something to do until traffic clears. My friend is the type who will hop on her phone, find a bar that's nearby, and she will be friends with everyone in that bar by the time she leaves because that's her natural personality. I'm more likely to be like, I can find a really cool little lookout and I can get my book and I can read all by myself and not be disturbed. So
Yes.
very different approaches in personality. So know your personality and also put yourself in situations that if you need that little boost are more likely to make it easier for you to break through. It is absolutely like dating.
Yeah. Awesome.
One thing I talk about with, my clients is volunteerism and you mentioned this already, as a way of, connecting to maybe like-minded people. But I do think that's kind of like dating too, because you can try one volunteer activity and you're like, oh, I don't think I like that. So let's try another. But it is looking at, it's getting out of your comfort zone. It's looking outside the box, and it's all those things that, make it a little bit more difficult, right? As all the examples you've given, which are really interesting to think about. And I'm sure our listeners are going to be like,
Yeah.
I'm just glad that we're talking about all these things. So this brings, you mentioned couples a little bit, and certainly know you're not a couples therapist, right? I mean, but I think I'm sure hear from many women in midlife about this, the concept of empty nesting. And I'll just throw it out there. I'm a recent empty nester, and I think it is, it's an interesting time, along with everything else going on, when you find yourself alone with your partner of maybe 25, 30 years, or, how many years doesn't really matter, but quite a while, maybe even more, more than half your age, right? Like you've been with this person a long time, but then you've had lots of distractions with kids and activities. And then all of a sudden you're an empty nester. And I find that the questions around that are really funny. Like people are like, so how are you doing as an empty nester? It's like so loaded, right? You're like, well, like how much time do you have? But anyway, how do you like, do you have magic for your women in midlife around reconnecting with partners or, really digging deep and maybe finding that it's time to move on in a loving way, that maybe it's this is the next chapter, maybe it's a new chapter with a new partner. It can mean a lot of different things. So what has been your
Yeah.
experience, and how do you you know help people, advise people to move in all different ways?
Um, Interestingly, I think yes, empty nesting. And I also will say, my clients who've chosen not to have children or couldn't have children, whatever it is, that don't have children, the same thing happen.
Mm-hmm.
They've had other things that I call the insulators. So it might have been that they, like,
Oh.
again, they were climbing the mountain of their corporate career, and they got there, and now they don't need to be there 50, 60 hours a week. So there's this point where you look around and kind of like the insulators, the kids, the distractions, and you may look up and go, "Oh, I don't know you at all. I mean, I know you, I live with you, I sleep next to you every night, but I don't really know you at all." So one of the things I like to ask women is and say, "Hey, first of all, let me say this, especially if they're my clients who come in doses, I can kind of say to them when they have a freshman in high school, like, this is the baby, right? Um, they're going to be gone in 4 years. That's going to happen in a blink. And how's your relationship with your partner?" And they got to go, "Oh, yeah." I haven't wanted to think about that. Or sometimes the answer is actually great. We've always done all the things that they recommend, and we like really enjoy each other's company. We do date nights. But if that's not the case, I say now is the time, if you can, to start things like implementing a date night. And I get it, it can be once a month, but start remembering, what do we really like about each other? What happened? Because if you can go on date nights more often, you're going to quickly discover that you can't fill every date just talking about the kids. If you only do date nights twice a year, you can. So again, it gives the illusion of this commonality, but you're not really figuring out what do we like about each other? What's those things? So I ask people to look back at kind of what brought you to that person to begin with. Are those factors still things that are important to you? Because over the course of 25, 30 years, you've changed and they've changed.
Mm-hmm.
So maybe you've changed in the same direction. Maybe you've changed in opposite directions. And opposite directions does not have to be a disaster. It's okay as long as you learn to acknowledge those things in each other and talk about those things with each other and feed those things in each other. But you do have to acknowledge it to begin with. Like, ooh, we're on very, very different pages about certain things. We have very different interests at this point. Maybe it's that you met because you both love to ski. And since then, one of you has had an injury and can't really ski. And so these are very different interests that you have now, because the person who can't ski has kind of figured out a way to have these other things. Okay, acknowledge that and talk about, well, how do we find common grounds? Maybe we need to find an activity again that we can do together. So that's one of the things I want you to do, is to say, who are you now? What excites you now? What are you interested in? And have those conversations with your partner. And I always have to remind people, cliches exist for a reason. Yes, it's a very cliched answer, but that's because it's an answer that people give all the time, because there's probably some reality to it. So when I say, maybe what you need to do is set up a mandatory date night, and keep it realistic. Don't like try to think you're going to go out for 4 hours if you guys haven't sat down alone to dinner in 15 years. But do an hour and a half. Just start doing things that force you to have connection and to have conversations about, what are our shared interests? What do we both want? What are our goals? Where do we both want to be in 10 years? Where are you struggling? I know where I'm struggling. I mean, I think I know where you're struggling, but I don't want to assume. Talk to me about, where are you struggling? What's been hard for you lately? Start having those deeper conversations with your partner. Those things can really help you reconnect and find one another again, in a way that, again, you don't have that insulation there. So you may not have been as aware that you had lost track of that thread between you at the time. If you are doing these things, if you find yourself saying, I'm trying to find things about that we have in common, or that we can both get excited about, or interests, or support one another, you're reaching out to your partner and you're saying these things, and you're not getting the response you want, that is a different sign. There's very, very well-known couples researchers, the Gottmans, John Gottman, and they've done tons and tons of research on couples. And one of the things I will talk about using some of their ideas with clients is if you're doing all those things, if you are actually reaching out and you're getting met with what they call the four horsemen of the apocalypse, these are four things that happen in relationships that I know it's a great name, isn't it?
Yeah, it is.
These are four things that happen in relationships that are pretty much a sign that there's very little hope of this relationship being salvaged. Then they can actually predict divorce incredibly accurately years out by looking at if these things are happening in conversations. That's a sign. So the things I'm looking for is, let's say you go to your partner and you say, I'm realizing like I the kids are gone and this is very strange for me, and I really want to reconnect with you. And I'm thinking of some ideas to do that. What do you think? And if you get you know, I understand what you're saying, but I got to be honest with you. I'm really busy. Nothing has changed for me. Your life may have changed, but nothing has changed for me. And I just really can't fit that in. Interesting. They're very critical of what you're saying. You're getting this criticism, or they take it a step further. They're not just criticizing you asking for more for them. They go into a place of, I warned you over and over again this was going to happen. You had no life but those kids. That's all you could ever focus on. And now you expect me to fix your problem. This is not my problem. This is your problem. I have a very full life. I'm sorry you don't, but that's on you. That's contempt. So when you're getting something like criticism, you're getting something like contempt, or let's say they go into you give them that and they say, I make an effort to do stuff all the time. I don't know what you're talking about. I asked you the other night, did you want to go out for pizza? You said no. Well, I had a headache. Oh, you had a headache, but it's somehow I'm not doing something right because we didn't go out. Like, I don't know what you want from me. Defensiveness. You're going to start looking for, are these the things that you're getting? Or they just shut you down completely, which is stonewalling. If they just, you know what? I don't know what you're talking about, and I think we're fine. I'm happy. If you're not happy, I don't know what to tell you about that. So I say, you're going to be looking for these four horsemen. That's the thing. If you're making all the right efforts, and I'm kind of coaching them through how to talk to their partner and to say things in a way that they're not, you don't want to start with a criticism. We never do anything. You never make it. No, that's not how we ask our partner to engage with us more. Stop, listen to yourself. Okay. They weren't in your mind having the conversation for the last 2 weeks. So they don't know what's behind all this. You never make an effort. That you got to say like, hey, I miss you. And so if you're trying to do all these things the right way and you're being met with any of these things, then that can be a pretty clear sign that maybe it's time to think about whether or not this relationship can really meet your needs. And is your partner interested in meeting your needs? And maybe it is time to think about, maybe the relationship has run its course and has served its purpose, and it's time for me to consider something else.
Yeah, there's such a high rate of divorce in this stage of life as well. A lot of people relate it back to menopausal symptoms as well. And I love that how you talk through the way to communicate and how you help your clients learn to communicate, because obviously that's the most important piece, right? To me, what I'm hearing is not only how to communicate with your spouse or the people, your friends, but also how to communicate with yourself. How do you want, what do you want, and have those internal conversations as well, because they're so important, because otherwise you're going to start latching yourself onto people that aren't going to actually help you through life, or not going to fix the void that you're having. You're just latching onto anything, right? And so I think I'm like ready to sign up for a session with you already, because it's just, how can that not help anybody, right? Just to understand yourself better will help so much in all aspects of your life. So not even just menopause and not just transitions.
Absolutely. And being honest with yourself about relationships. That's another big part of it is, now that we recognize hormones, I'll get women coming in and they'll be like, I listened to you and I'm back on my hormones and I do feel better, but the sex life just isn't coming back and I'm doing all the things. And I dig a little deeper and I say, okay, well, what was your sex life like before you had children or once you had children? Well, it was never great. Okay, well, we have a bigger problem then. I don't know what you're trying to get back to.
Right.
So
Yeah.
hormones aren't going to be a magic bullet to fix
No.
that for you.
Yeah.
It may be addressing some other things, but let's be honest about what's going on in your relationship and what's happening. And so yeah, it's a very complex thing because you don't want to just grasp onto relationships for the sake of grasping onto relationships. You don't want to try to salvage a relationship that was never the relationship that you've told yourself it is, but it never was that. There's a lot going on, which is why this transition of relationships can be a really important thing, but a very complex thing at the same time.
Yeah. So tell me a little bit more about what you said about hormones. So because that's actually where I was hoping to go next. So that's perfect. Um, I just liked how you said like, oh, I told, they got back on their hormones, then came back and this. What are you seeing or how are you managing that to kind of say, okay, I think we are as kind of as far as we need to go. You probably need a little bit of help with those either fluctuating or loss of hormones, right? We're not that, yes, therapy and talking with someone and all of these things are fantastic. But our loss of estrogen, the loss of resiliency, the changes in our brain that are occurring, the changes, I mean, it literally can make you, it can change your attraction to a person.
Mhm.
All of a sudden you're like, I don't
Absolutely.
even find him attractive or her attractive, right? Like it can
Mhm.
change so many things. So where do
Uh-huh.
you see whenever you're working with somebody, how do you usually kind of handle that conversation or what do you see that you're like, nah, I think we need to go to the hormone route?
Honestly, for me, if they're in perimenopause and they're seeing any increase in symptoms all of a sudden, that is going to be now one of the first places I'm going to go. And probably always have, but now it's just so much more accepted because we're acknowledging that this loss of estrogen really has an impact on all these different things. So, if I have somebody who I know has always run anxious, they may have been on some kind of low dose medication on and off their entire adult lives, and they've popped in and out of therapy with me, but then they show back up for a tune-up at 45 and they're saying, I I went back to my psychiatrist, they've upped my meds, I'm still not sleeping, and now I want to add another, I think I need more sleeping medication. And I'll say, okay, okay, okay. Can we first go check what your hormone levels are? Are you in perimenopause? Some of this may be that, yes, your baseline is not the typical baseline. We know you run anxious, but you add that your hormones may be all over the place. It could be taking what is for you, your normal baseline, and making that far worse. So before we go down this road of continuing to up your psychotropic meds, which I'm a fan, if we need them, I think they're great, but they're not the end all be all, and they shouldn't be the answer to everything. I've always been a bring everything in kind of therapist. Acupuncture works, great, let's go try it. But let's first see if maybe this is one of the things that will help, if nothing else, stabilize what's going on. We can get your hormones regulated. Can we get you stabilized? Because again, it's like I was saying about the thyroid, so many things can be the same symptoms. I'm not sleeping. My mind is racing. I'm
Yeah.
having a really hard time focusing. If you're somebody who historically has dealt with anxiety and depression, you understand those to be symptoms of your anxiety and depression because they are. But if they're suddenly much worse and there's no clear reason for them to have gotten worse, let's look at what else may have changed. And what could be changing is your hormones. And we need to find that balance between all those things before we can really say, okay, we've got all this straightened out. Now let's try to talk about what tools can we put in your toolbox to manage this better.
Yeah. I wish I could reach
Yeah,
through
that's
this and
great.
give you a hug because, and I think that all the women listening to this will feel the same way because it's like, thank God somebody gets it. So thank you,
Yeah,
Dr. Elena. That
I
was
know.
very well said. Thank you.
Yes.
Well,
Well,
thank you so much.
what rang a bell too is like, you're like, I'm an all in therapist. And I just think, well, I have a couple questions around that because I think this time of life, as the other times of life around puberty and postpartum and now perimenopause, there's a team, right? We usually have a team of people, of providers, and that doesn't always happen for women, and it hasn't happened
Hmm.
historically for women in perimenopause and menopause. But you saying like I'm an all-in therapist, just like I was like that is golden, right? That's gold. Like, and I know I've talked to you in the past prior to even today and how you work closely with an OBGYN practice here in the Chicagoland area and or in maybe others too. But how common do you think it is for therapists to have this philosophy about like, I'm an all in? I'm just curious. And I think it's just really important for women in midlife to even maybe even ask these questions as they're seeking out a therapist. Like, how do you have a relationship with any OBGYNs? Do you know acupuncturists? Do you know massage therapists? I mean, it's just so important. And not that we can all have all those services by any means, but I think to have a really well-rounded practitioner in your court is really important. So I guess my
I
first question is just how common is it?
I wish it were far more common. It's not to me as common as it should be. I've always practiced that way. I've always felt strongly that if it works, it works. And I just want you to be happy and healthy and feel good in your own life and skin. And I may or may not be the answer or a part of the answer, but I'm open to let's try to find out what the answer is. And sometimes that means like, hey, let's get you a personal trainer. I think that you're not exercising enough, you're not getting out there, you're not doing enough, or let's find you a walking club because you need to be getting some fresh air every day. Or are you open to trying acupuncture? Let's see if that's working. Even Reiki. Like I feel very strongly that let's bring in the whole team.
Mm-hmm.
While I absolutely know therapists who kind of have that same approach as me, I definitely do know some that are tend to be a little more hyper focused on it must all be around that this is what we were taught and this is what it is and we're not going to look outside the box of that. And that's really unfortunate. And I feel like it does everyone, but especially women, a disservice because we know, as we were talking about perimenopause and menopause, we know that hormones can impact a lot of these things that can look like mental health stuff. And they're probably intertwined. It's probably not one or the other. So if it's not one or the other, why are we only using one tool to address it? Let's get a lot of tools in your toolbox. Let's get a lot of providers and let's talk and let's see, hey, I'm worried. I know you upped her psychotropic med over here for sleep. I'm not seeing any increase. I'm going to put a call into her OB. I'm going to see if maybe we can up her estrogen and let's see if that happens. And if you have that team that works together, then you're going to provide such a better level of care for your clients when you're able to do that.
Yeah, and Angie and I have talked about before that like it takes a village, right?
Yes.
Like I mean, it really does. And
Absolutely.
Angie,
It
I think it's a
really
great
does.
point. We get that not everyone can have all of these different modalities, but it's finding the modality that works for you. And if it's one, hopefully it's probably going to be one or two, and then leaning into those. Like we can give up our getting our nails done and our big, fancy bags and those kind of things to take care of ourselves, right? And so like sometimes we got to shift some of our priorities because it does take a village and a care team. Like so many people would just want to be like, I have this doctor, and if this doctor doesn't tell me XYZ, that's not what I'm not gonna do anything different. And
Mm-hmm.
it's like, no, you need different scenes of opinions. You need other people having, input as well. It's never been meant to be just one person. And I think that's, that makes
Absolutely.
so much sense. You mentioned kind of all the fluctuating, and we've talked about it kind of throughout the whole time, whether it's transitions in life, fluctuations of emotions, of, the resiliency, what have you. On your website, you have this term called emotional equilibrium. And I think that's so beautifully coined. I'd love for you to kind of explain what that is and maybe even how you get people to that.
Yeah, we're gonna have fluctuations emotionally. If everything is perfect, if we were blessed to have the perfect brain chemistry and we never suffer a moment of anxiety and depression in our lives, and if our hormones are always balanced, all the things are in place and perfect, you're still gonna have ups and downs. That's just the reality of life. For me, the thing is, within those ups and downs, are you hitting places that are so high that it's making you miserable or so low that it's making you miserable? And my goal is to work with you so that we find some kind of equilibrium. We find a balance that you can kind of maintain that kind of goes back and forth like this. But, the idea is that, oh, I know I'm getting a little too high on this, and I have the tools to help myself come back to here. And now, oh, that was a little too much, because that's how life goes. So when I talk to him about emotional equilibrium, I say, hey, how do we find a way to give you the tools to get a balance, or know how to get yourself back to balance when things feel uncomfortable? When you recognize this is not something that I want. This is not something that's making me feel good. Or I feel okay, but I can tell from the looks on the faces of the people around them, maybe I'm not as balanced as I thought I was. Maybe I need to tone something down a little bit. So that's why I think emotional equilibrium is what I talk to women about all the time, is that it's really important to say, hey, that's the goal. Our goal isn't perfection. It's just knowing how to kind of keep that balance and kind of find the equilibrium and know how to adjust and balance as need be, so that day to day you feel good. Because that's really my goal, is that if I talk to someone overall, they'll say, yeah, it was a really hard Tuesday, Wednesday, but things are feeling better. I feel good today. I was able to do these things. I remembered what I needed to do. You were in my head, so I went and I journaled. I'm doing better now. Okay, good.
Mhm.
You're learning how to bring yourself back to a baseline that feels good to you.
Awesome. Thank you so much for explaining that. It's perfect.
Yeah.
Love it.
Yeah. So important. I love it too. Emotional equilibrium.
Yes.
That's a takeaway for me. That's great. Well, I feel like we could talk to Dr. Alaina all day,
Yep.
but at some point we have to say goodbye. No, but don't want to end there. But and hopefully we can have you on again sometime. And there's several other topics I think we could cover, and I think our listeners are gonna agree with us. But another quote from your website, and it kind of take a question from here, but is you deserve, on your website, it says you deserve to be thriving, not just surviving during midlife. And I think everyone listening today would get that that's one of your mantras, if you will, or your, because everything that you've talked about supports just that. And I guess, just last question, anything that you would want to leave with our audience today, one more thing that we may have missed, or just sort of how to close out this conversation? Do you have something to add?
Pretty much just piggybacking off of that. You deserve to be thriving, not surviving. And evolutionarily, we aren't that far out from where living past 50 wasn't the assumption. And so there was almost this idea of, once you hit 50, 55, you're doing well just to be making it day to day. And that is not the goal. The goal is to be thriving. The goal is to be continuing to learn and grow and explore different facets of your personality. Development is going to continue. Who you are is going to change. If you look back at who you were at 20, if I went to both of you and said, at 20, when you were in school studying to be nurses, what's your career going to look like in your 50s? I'm going to bet it looks nothing like it actually looks now. Same thing, like what we're doing at 50, it's okay if it looks very different at 30. It should. I mean, at 80, 30 years down the road, it should. And you deserve to be thriving and growing and learning. And that should be the goal. Not just surviving, not just getting by, not just kind of waiting it out or sitting on the sidelines. You should be thriving and living your best life at all developmental stages of your life.
Yes.
Excellent.
Yes, yes,
And
yes.
our toolbox looks different at 50 than it did at 30, right? It's
Absolutely.
much more full. It's, just full of different tools, if you will. But,
Mhm.
yeah. Awesome.
Absolutely.
Well, thank you so
Absolutely.
much for spending this much time with us and our listeners, and can't wait to have you on again in the future.
Well, thank you so much for having me. I truly enjoyed this conversation. I love this kind of conversation. I love talking with like-minded women.
Agreed. Yeah. And Dr. Lena, I just feel like I'm walking away with so many like tools that I'm ready to use. I have so much great advice in that, that I really appreciate that. So I just want to remind our listeners that if they enjoyed this, and they can subscribe, please subscribe. give us a like. So if you subscribe, you won't miss future episodes. And Angie and I will be talking to more experts that you will want to hear from. And hopefully we'll talk to Dr. Alaina again in the future. So thank you again, and we will sign off. All right, Dr. Alaina, we like to do a lightning round or rapid fire questions at the end of our interviews. So here we go. Coffee or tea?
Coffee.
Cookie or cake?
Cookie.
Cats or dogs?
Ooh, does it have to be rapid fire? Um, cats if you have little kids, dogs once you don't have actual toddlers at home because dogs are perpetual toddlers.
Oh God, isn't that the truth?
Oh, Rice.
Comedy or
Who
horror?
said
Comedy.
And what is your favorite self-care practice?
Meditation.
Mm. And what about your favorite quick energy boost that is not caffeine?
Taking a walk. Taking a walk.
Love it.
Mm.
How about I mean, I know we're in midlife. What's one thing that you wish you would have known about midlife? And that is then actually a positive of midlife.
Mm.
More confidence.
Yes.
A lot more confidence now.
Love that. And one last one.
Mhm.
Which one's worse, or which one do you do more? Forget names or forget what you walked into a room for?
Mm. Probably names.
Names. Okay. Well, thank you so much for enduring our rapid fire questions.
Yes.
Appreciate.
Thank you.